The broadcast is now starting. All attendees are in listen-only mode.
Good morning or good afternoon, everyone, depending on where you are coming to us from. This is Kristen Justice with BeyondPay, and we are going to be starting our insight here shortly. We want to give everyone about 30, 60 more seconds to get comfortable in front of their monitors and give a few more people the opportunity to join for today's insight. So again, this is Kristen Justice with BeyondPay, and we will be beginning shortly. All right, let's go ahead and get started. So thank you all for taking time to join us today. Again, this is Kristen Justice, and I am the Regional Sales Manager for BeyondPay, and we are thrilled to bring you today's insight, which is going to be conducted by our partners over at HR Support Center. I see a lot of current clients on the line, as well as new companies that we have yet to talk with. So thank you all for taking time again to come join Sarah, Jenny, and myself to learn all about the healthcare reform and basics of benefits. So at this time, I'm going to go ahead and turn it on over to Sarah.
Perfect. Thank you so much for that, Kristen. I am really excited to welcome you to our training, Healthcare Reform and the Basics of Benefits. We're really pleased to present this topic, and really thank you for joining us. I would love to introduce you to our presenter, Jenny. Jenny is a human resources consultant with over 15 years of human resources management experience. The majority of her career has been spent working in a human resources consulting capacity, especially adept with small to mid-sized businesses. Jenny has worked with clients in a variety of industries to reduce exposure to employment-related liability and assist clients with employee relationship issues. Jenny resides in Madison, Georgia with her husband and 2 children. Before I turn it over to Jenny, I would love to note that a PDF of the slides can be found under the materials icon, and we would love this to be an interactive training and invite you to chat in questions throughout the presentation. We look forward to responding during the Q&A session scheduled afterwards. All right, at this time I'll turn it over to you, Jenny. Thanks again, everyone, for joining us.
Great. Thanks, Sarah. I appreciate it. Again, my name is Jenny Arthur, and I'm one of the pros in the HR Support Center. And it is my pleasure to speak with you today regarding benefits. I'm kind of a benefits nerd, so I'll try not to get off on too many tangents, but I really, really enjoy this presentation. It's very cool. What we're going to be doing is going through the decades and talking about health insurance laws and how they affect you. So by the end, you will have a comprehensive understanding of what you as an employer need to know and need to do when it comes to health insurance laws. So we'll start with the 70s. We had really, I would actually consider all of these things pieces of healthcare reform that we've had along the way. I consider ERISA and COBRA and HIPAA. Those are pieces of healthcare reform. But as you are probably aware, we've never had anything as comprehensive as what we got about 5 years ago with the Affordable Care Act. So I'll be spending about the first 15 or 20 minutes going through and talking about some of these other things that provide certain requirements for employers to follow when it comes to benefit plans. And then I'll be spending probably a good 20, 30 minutes just on the Affordable Care Act and the provisions that most affect employers. So again, I like to go chronologically because, you know, really these regulations build upon each other. So I think it makes the most intuitive sense to walk through benefits laws chronologically. And so we're just going to be kind of strolling through the decades together. And we'll go ahead and get started with the 70s. One of the main benefits of having this done by decade is these cool decade-themed pictures you're going to get along the way. So that's cool. So we're going back in time to the 70s. And we'll be talking about 2 things in the 70s, ERISA and Section 125. And if you don't know what either of those are, that's okay, because we're going to get into them, okay? So ERISA basically was in response to a lot of private pension plans. Remember back when we used to have pension plans and retirement plans that were more of a defined benefit plan. And basically what happened was a lot of these were mismanaged and abused. And so back in 1974, President Ford signed the ERISA Act. And actually what it did was, well, basically I'd like you to kind of have an idea of the history. It was mostly in response to Studebaker, that company. When Studebaker terminated their pension plan in the late 60s, and all those people who worked there lost all their retirement, and everyone, there was a huge public outcry for how unfair that was. So really this was mainly designed to protect people who had their money or their retirement in pensions plans. But it also, kind of as an afterthought, they decided to apply it to health insurance plans as well. So basically what it requires is it doesn't ever require a company to offer a health plan or a retirement plan or anything like that, but it puts certain rules in place if you do, okay? So it makes you do certain things. If you decide to sponsor a health plan or retirement plan, there's certain things that you have to do to protect participants. So basically I've kind of narrowed it down into 4 main kind of general things that you have to do under ERISA. First is that you have to give your participants information about the plan. So it's not fair to not provide them with kind of a listing of rules of how the plan works. And that listing of rules is called your summary plan description, okay? Your summary plan description is required to be distributed by the employer. So if you sponsor a group health plan, you need to have a summary plan description. And if you don't know where yours is, it's time to ask your broker or carrier where that is. It's kind of your listing of rules, who's eligible for the plan, how long's your waiting period, all those types of things. It's kind of how the plan works. So make sure if you don't already have copies of your SPD or summary plan description that you make sure you talk to your broker or carrier and get that, okay? You need to have that, and it has to be distributed to employees every 5 years unless the plan changes substantially. And then you also have to, if you sponsor a group health plan, you just have to meet certain codes of conduct. You can't be shady with the way you administer your plan. You can't make money off the plan. And one of these main ones that most applies to employers is non-discrimination. And we're going to talk about that here in our Q&As in just a minute. Also, you have to provide, if you sponsor a health insurance plan, you have to report on that plan to the federal government. You do that using your Form 5500s each year. So there's an annual reporting requirement if you sponsor a group health plan or retirement plan or any plan that's covered by ERISA. And you also have to provide certain disclosures to your participants. And I mean, there's a ton of disclosures they have to provide to participants. And we get lots of questions about this because it's really overwhelming. But here on this next slide, I'll show you, this is a list of all the disclosure notices that you are required to provide to participants if you have a group health plan. Now, the employer is ultimately responsible for all those listed under employer, okay? But that doesn't mean it's the employer that actually gives those out. A lot of times it's the carrier who does this for you or your broker. So my recommendation is to take this list here, and you have a copy of this in your handouts, this presentation, is to take this list and ask your broker or your carrier or both, who's handling all these for me? Because I know ultimately it's my responsibility that these get done. And hopefully they can tell you, make sure that all that's getting done. And then the carrier also has certain requirements, and some of the requirements are kind of shared between the carrier or employer. But it is really important that you make sure that that is getting done. Okay? And some of the main questions I get asked about ERISA, and I made a little slide of them so that you'll know, what questions I'm talking about here. The first question I get asked a lot is our health plan covered by ERISA? And the answer is yes. Almost every health plan in the United States is covered by ERISA. There's a few exemptions if you're a governmental entity or if you're a church or if you're located outside the U.S., but those are pretty obscure. So basically, yes, your health plan is covered by ERISA. And all the ERISA requirements, when they talk about ERISA, it's funny because they always talk about this is the plan sponsor's responsibility, and people are always asking me, who is the plan sponsor? And the answer is the employer. The employer is the plan sponsor. Those words are interchangeable when a company sponsors a group health plan. So just like to clear that up. I sometimes get asked, what is an SPD wrap document? We talked about how important it is to have that SPD on file. But also, I like to just mention that a lot of companies, especially smaller companies, don't have a complete SPD. Instead, they take the information about the plan that the carrier gives them, like in the insurer's certificate, and they add a little bit of language to that, and those two things together make up the SPD. So again, if you take the insurance carrier's certificates and you add those to maybe a little language that you write that has the SPD requirements in it, those two things together can collectively satisfy your SPD requirements. So So that's very common for a small employer not to write a complete SPD, but to just kind of add a wrap to some of the things, add a document to some of the things that the insurance carrier has already provided to you. And so those two things together would be your SPD wrap. So I get asked that a lot. And then probably the biggest question I get asked, it's kind of a HIPAA ERISA combined question, but I put it here, is can the employer exclude certain employees or certain classes of employees from their health plan? Or can you offer different levels of contribution to your health plan? And the answer to that depends on your health plan. If your health plan is a fully insured health plan, meaning you have an insurance carrier and they manage all your claims for you and everything, you don't pay any claims out of pocket, and most small businesses do have a fully funded health plan. So as long as your health plan is fully funded, you are allowed to set certain classes of employees and do different things for different classes of employees. So that's usually best demonstrated by example. Here's an example, is if you say, okay, Jenny, we pay 100% of employee-only coverage for managers, but we only pay 50% of employee-only coverage for our line employees. Is that allowed under ERISA? And the answer is yes, that is still allowed. So you can still make distinctions as long as those distinctions are based on legitimate employment-based classes of employees, okay? So you can't just, all similarly situated employees have to be treated consistently, okay? But as you can set out certain classes of employees and offer different plans to those classes or different contribution levels to those classes, and that is permissible under HIPAA and ERISA, okay? I like to point out in contrast to that, if you offer a self-funded or self-insured health plan, and your carrier should let you know, or not your carrier, your broker should let you know if you're self-insured at all. Hopefully you would already know that. There are some IRS codes that do not allow you to discriminate in terms of different classes of employees. Basically, you can't discriminate in favor of any highly compensated employees, which is fairly broadly defined. So really, you pretty much have to offer the same contribution to everyone if you sponsor a self-insured plan. But again, you can still make those distinctions based on classes if your health plan is fully funded. So hopefully that makes sense. We're going to talk about it a little bit later when we get to the Affordable Care Act and health care reform, that there is a provision in there that precludes an employer from doing that, but that provision has been indefinitely delayed. In fact, I'm not sure it'll ever go into effect. It was supposed to go back into effect back in 2011, and it still hasn't, and we really haven't heard much about it. So I'm kind of doubtful that it will go into effect, especially with the political arena right now. So you can still make distinctions based on legitimate employment-based classes of employees is kind of the main idea there. Okay, and that will move us on to our second thing in the 70s, which is Section 125. You may have heard that Section 125 is the actual number of the section of the tax code that allows an employer to offer benefits on a pre-tax basis, right? So you can enjoy, the employee doesn't have to pay FICA, FUTA taxes, income taxes off of the money that they're contributing to certain plans that are eligible under your Section 125 plan. Okay, so in order to do pre-tax deductions, you have to have a written cafeteria plan in place. There's two different kinds, but unless you're offering flexible funding accounts, you'll probably have a premium-only plan, which is called a POP, a premium-only plan. And it is a written document that allows you to pre-tax benefits, okay? And it does limit, it's a great benefit. It's a great benefit to the employer and the employee. So the employee saves money, however much their tax rate is, they save, however much they would pay in taxes on that money. And the employer saves money as well because they don't have to make like FICA and Medicare contributions to those deductions. So it really is very beneficial, and almost every company that offers benefits does use that, that advantage under a Section 125 plan. The one major trade-off is that it limits when an employee can make changes during the plan year. They can only make changes if they have certain qualifying events or if the government announces certain special enrollment periods, or else they can only make changes at open enrollment. And I'll kind of walk through those qualifying events with you here in just a minute. But a Section 125 plan, when you think about it, it is actually the only way that an employer can offer an employee a choice between, okay, you know, not having taxes on that money Or in a true cafeteria plan, you can actually offer opt-out pay or declination pay. You're not required to do that, but you can, where they can choose to take that money as taxable wages. So they can actually, in a straight true cafeteria plan, that's typically how they work. But most companies use more of a premium-only plan, meaning that if they elect benefits, will be taken on a pre-tax basis. So next slide here, I'm going to show you some plans that are eligible under a cafeteria plan. Okay, so a lot of benefit offerings you can do on a pre-tax basis, and unless it's otherwise listed on here, it shows you what employment taxes they will be, they don't have to pay. So unless I've otherwise noted it here, they're exempt from FICA, FUTA, Medicare tax, and income tax withholding. And generally state as well. It just can vary by state. So pretty much all taxes, unless I've otherwise noted it on here. Like an example of another one is, you see that adoption assistance over there on the left. If you're offering that benefit, it is subject to some taxes. So I've kind of listed the exceptions out for you. But if I don't list anything, then it's exempt from all those taxes. Okay? And now I just want to kind of show you qualifying events and what those look like. I've divided them up into 3 categories: status changes, special enrollment periods, and then just some other qualifying events. So this is, again, a qualifying event is when an employee can make a change without waiting until open enrollment. So like maybe it's in the middle of the year and I want to drop my health plan, and you would have to tell the employee, no, you can't do that. You have to wait until open enrollment unless you have a qualifying event. And these are your qualifying events, okay? So here are some that are based on just like familial type changes to the family. Like, for example, if you get married in the middle of a plan year, you can add your new spouse to the plan, would be an example. So these are some of the status changes. And these are basically based on, familial changes here, or changes to your family. My next slide here shows some special enrollment periods. So these are special times when you may be eligible to enroll. Like, for example, if you were on COBRA with another employer and that COBRA expired, you already used your 18 months, then that would be a special enrollment period where you could come on your new plan. And I always like to point out that unless you have a qualifying event, you can't make the changes. And if you do allow employees to make changes at other times during the year, there's a lot of consequences to that. You could have back taxes for the participant or the company. And then actually your whole entire cafeteria plan can be disqualified, where you won't be allowed to do pre-tax deductions in the future. So it's really important to get these right. Our third category is, go back one, Sarah, I'm sorry. I do like to mention that last bullet says other times based on new legislation. I didn't really know how to write that, but an example of that may be like when healthcare reform came along and they said, okay, all employees can now keep their dependents on their plan until they turn 26. And it used to be like you had to dump them from the plan when they turned 19. That would be a time, right then they had a special enrollment period where all those people, those older children, could enroll in their parents' plans. So sometimes based on a new law, there'll be a special enrollment period. And here are just a few other things, other qualifying events. I don't really know how to classify them, but it's important that these are all qualifying events. So one example may be like if you become eligible for Medicare or Medicaid. Or another example may be if the plan right in the middle of the year increases costs like significantly, then those would be some other qualifying events. Okay? And here are my FAQs on Section 125 plans. All questions that we get asked a lot, so I think that they are important. The first one is, do I have to do any filing with the federal government to establish or maintain my Section 125 plan? And the answer is no. You do have to have a written plan document, but it doesn't have to be filed with the government. Okay? The second question I get asked is, what is the consistency rule? I talk about that rule a lot when we're talking about status changes. So what that means is, like, if an employee, let's say during the middle of the year they get a divorce, and so they want to remove their spouse from the plan. Well, that's totally fine. They can make that change. But what if they, at that same time, they say, and I also want to switch plans from the HMO to the PPO, and we would have to not allow them to do that. So the consistency rule basically says that whatever change they're making to their benefits has to correspond with the actual status change that they have. It has to be a direct result of that status change. Okay, so if you get divorced, you could remove your spouse. You could even remove the dependents of your spouse from your plan. But you couldn't just say, okay, and I want to switch plans, or I want to drop my coverage too, or anything like that. That wouldn't be compatible with the consistency rule. Okay. The next thing I get asked a lot is, does the employer establish a separate written cafeteria plan for each benefit it offers? Okay. So so maybe they have a health insurance plan and a dental plan and a vision plan. Do they have to have 3 different cafeteria plan documents? And the answer is no. In fact, the employer can only have 1 effective cafeteria plan document. It would cover all those plans, but they should only have 1 document. Okay? And this last question, I don't know if I'd call this last one a frequently asked question, but it is one that we get every now and then, and it is an interesting one, is if you sponsor a flexible spending account, I know that a lot of you may not, but if you do offer flexible spending accounts, if the employee uses all their money, all their annual election, like in the very first month of the year, like I'll say in January, and then they quit, and so they haven't had time to have all those deductions, is the employer out that money? Like maybe my kid needed braces in January, and I used my entire $2,500 annual election of my flexible spending account in January. Well, it's going to take me till December to pay all that back, right? But I'm not going to work there anymore. So can I, as the employer, charge the employee for that money? And the answer is no, okay? So it's kind of opposite of the use it or lose it rule with a flexible spending account. It can go both ways. The employee can lose the money because they didn't use it, or the employer can be out the money if they use, way too much in the beginning and then have like kind of a negative flexible spending account balance. So an employer cannot deduct a negative flexible spending account balance. That would violate the IRS code. Anyway, that was a little bit obscure, but it is an interesting question. So that got us through the 70s. You guys are doing great. We're going to go ahead and move on to the 80s, where we're going to talk about COBRA. COBRA is what I'd also consider a piece of healthcare reform. We got it in the 80s, and it basically was an amendment to ERISA. So it's kind of a part of ERISA, but it's kind of it finds its own set of parameters. So I kind of put it separate here. It was signed into law by President Reagan, and basically the reason it was passed was just to allow employees' insurance to be more portable. So if an employee were to lose coverage, that they'd have the opportunity to extend that coverage for a specific period of time, okay? So there's federal COBRA, which applies to employers. If you're on the line and you have 20 or more employees, then you're subject to federal COBRA. And there's also, in most states, if you have between 2 and 19 employees, there's like state continuation coverage, or what we call mini COBRA. But it basically just allows your health insurance to kind of go with you if you leave a job, or maybe you switch from full-time to part-time and you're not eligible anymore. Your coverage doesn't end just immediately. You have the opportunity to continue it at your own cost. Okay? An employer has a lot of responsibilities when it comes to COBRA, because the employer has to send out 2 notices. First of all, every time a new employee becomes covered under your group health plan, you have to send them an initial COBRA notice, which just says they're in a plan that's eligible for COBRA. And then anytime an employee leaves your group health plan, maybe they're terminating employment, maybe their hours were reduced to part-time, so they've lost coverage, you have to send them a COBRA notice and election form, which shows them how to actually enroll in COBRA. Okay, so there's 2 main notice requirements. These are the employer's responsibility unless you outsource it to like a third party, which many employers do outsource their COBRA obligations. If you're doing COBRA in-house and sending out these notices in-house, one thing that I think is really important for you to know is that you should make sure that the COBRA forms you're using, they're published by the Department of Labor, so you can just use their model notices. They've made some changes to them as of late, so I'd make sure the ones that you're using have that May 2014 date at the bottom, okay? So just make sure they have that date. That's the most recent COBRA notice. It's changed a little bit because of healthcare reform. All right, our next slide kind of shows you the difference between COBRA, the federal COBRA, and then state continuation coverage. So basically, COBRA has COBRA has these statutory requirements for how long you have to continue coverage. Generally, if an employee is leaving your employment, it's 18 months, and that's the most common. But it can be extended longer for disability, or they're losing the coverage because of divorce or death or something like that. So there are longer periods under some extenuating circumstances. Again, like we said, it's the employer's responsibility to manage COBRA or to outsource it. And you can charge up to a 2% administrative fee to COBRA participants. So when you're on COBRA, you're paying the entire premium amount. No longer, once you're on COBRA, no longer is the employer making any contribution to your plan. That's important to note. State continuation coverage is hard for me to really define because it varies so much by state. But in some states, it's actually administered by the carrier instead of by the employer. So that's nice. Like I know California is that way, where California employers with between 2 and 19 employees don't have any COBRA obligations because the carrier manages it for them. And like I said, sometimes it's called mini COBRA or state continuation coverage. So here are my FAQs on COBRA. The first one I get asked a lot is, once an employee leaves, how long do we have to get them a COBRA notice, okay? And the answer to that is 44 days. You have 44 days to get them a COBRA notice. Actually, if you outsource your COBRA to a third party, you have 30 days to notify that third party, and then that third party has 14 days to send the notice. So that 30 plus 14 equals 44. But if you do it all in-house, you get the full 44 days. Okay? And then after the employee gets their COBRA notice, they have another 60 days to decide whether they even want to elect COBRA or not. So a lot of COBRA stuff is done very retroactively. Okay? What is the penalty for a late COBRA notice? The IRS penalty is $100 a day for single coverage and $200 a day for family coverage. So you can see it is pretty substantial. Now, you would never be fined for a late COBRA notice unless an employee actually filed a complaint. Okay, so just, you know, it's not like an automatic thing. But if you're ever investigated, if an employee filed a complaint and the IRS came in to look, then you could definitely be subject to some COBRA notices, COBRA fines. My next question is, what if the entire health plan is discontinued and a new one is not obtained? So we get asked that a lot if an employer just decides they don't want to sponsor a group health plan anymore. When they stop it, do they have to offer all employees COBRA? And the answer is no. If there's no plan to COBRA off of, if the health plan's been discontinued, then the employer has no COBRA obligation. Sometimes I get asked, people hear about this provision of COBRA that, is it true that you don't have to offer COBRA to employees who are terminated for gross misconduct? It actually is true. There's a provision in COBRA that says if the employee was terminated for gross misconduct, you don't have to offer COBRA, but the courts narrowly interpret that. So you have to be really careful with that one. Gross misconduct, and this is the actual phrasing from some case law, says that it has to be an illegal or dangerous act that was extreme and outrageous in nature. Okay, so being late would not qualify, or violating company policy or something like that. It would have to be pretty extreme and outrageous to rise to a level of gross misconduct. So we just recommend offering COBRA to any eligible employee who is leaving or would be eligible for COBRA. And the last question is, we just hired our 20th employee. Does COBRA apply right now, or is it still state continuation coverage? And that's a great question. You have to have at least 20 or more employees on your payroll for more than half of the work weeks in the previous calendar year. So that gives you a little time to transition. I'll say that again, 20 or more employees, at least half of your work weeks in your previous calendar year. And for this purpose of 20 employees, it's not 20 full-time employees, it's 20 full-time equivalent employees. So full-time employees for this purpose are ones that work 40 hours a week. So if I worked like 20 hours a week, I would be considered like half of an employee for this purpose for COBRA. It's a little different when we're doing those calculations for the Affordable Care Act. But for COBRA, it's based on a 40-hour work week. Okay? So that got me through COBRA. And now I'm going to spend a little bit of time. We're going to move on to HIPAA in the 90s, okay? So we're just strolling right through the decades. We have made it to the 90s. And here in the 90s, we are going to talk about HIPAA. So basically, HIPAA, I kind of do it into two different parts, because HIPAA was so different in the early years as it was in the later years. It's another amendment to ERISA, but again, since it has a lot of its own specific provisions, I brought it out of ERISA. It was passed in 1996, so we were in the Bill Clinton era. At the time, there was a lot of momentum for more comprehensive health care reform, something more like what we got about 5 years ago. And you may remember that. That was when, Bill Clinton was elected president and his wife Hillary was kind of charged with health care reform at that time. So there was a lot of momentum for comprehensive health care reform. And HIPAA was a little bit of a compromise where we really didn't get comprehensive health care reform, but HIPAA provided some important protections for employees at the time. The main reason HIPAA was passed was for an employee who's going from one company to another. At the time, there was this pre-existing condition exclusion. So like if I was diabetic, if I was going from one company to another, going from one health plan to another, the new health plan wouldn't have to cover my diabetes because it was a pre-existing condition, okay? So HIPAA changed that, and it said as long as you don't go without, 63 days or more without coverage, then your pre-existing conditions have to automatically be covered. And that was a huge deal at the time. It's not a big deal at all now because now the Affordable Care Act already says that no health plans can have pre-existing condition exclusion. So this was all repealed at the end of 2014 because it just really wasn't necessary anymore. But that was really the main reason that it was passed. So I like to point that out. As kind of a side note, it did want to do a lot of things for putting digital healthcare records, just kind of bringing healthcare into the modern era when it comes to technology, and also address privacy a little bit. Like now when we think of HIPAA, we only think of privacy, but it was actually a little different when it was first passed. One of my favorite things that it did was it allowed patients to own their own medical records, okay? So before HIPAA, your medical records were not owned by you. They were owned by your your healthcare provider, like your doctor. And there was a great Seinfeld about this. You probably remember with Elaine, and she goes to the doctor, and she refuses to put on one of those paper gowns, and so they put a note in her medical file that says that she's difficult. And then she and Kramer keep trying to steal, her medical file, and it's all this drama. But anyway, because at that time, back when that show was on, Elaine wouldn't have owned her own medical records. But that has changed. HIPAA allows us to own our own medical information and our own records. Now HIPAA looks completely different. So we'll go one more slide. This is the later years of HIPAA. And I like to point out this is huge for health insurance carriers. It's huge for health insurance brokers, but it's not very big for employers. So I'm not really going to go through all this stuff, but this stuff says a lot. These are all rules that have been enacted to protect patient privacy. And employers are not HIPAA-covered entities unless they are in the healthcare industry in some way. So mostly on the line, if you're not a doctor's or dental office, or you don't, not an insurance company or something like a health insurance company, you don't broker health insurance, then you're not a HIPAA-covered entity. So these rules here wouldn't apply to you. Okay, so and I like to point that out. Just because you sponsor a group health plan doesn't make you a HIPAA-covered entity. You don't have all these privacy rules. Now, of course, it's a best practice not to disseminate employee health information, but I get questions all the time like, okay, are we even allowed to ask for a doctor's note, or what if our medical records aren't locked? Is that a problem? And if you're not a HIPAA-covered entity, those things don't really apply to you, so you don't have to worry about them as much. So my last slide here on HIPAA is basically what we're talking about. Is an employer that sponsors a health plan a HIPAA-covered entity? As long as the health plan is fully insured, no. So actually the health plan that you sponsor is covered by HIPAA, but it's a separate legal entity than yourself as the employer. So you're still allowed to ask for a doctor's note. You're still allowed to take health insurance forms from employees and give them to the carrier, that type of thing. You are not, most of you on the line would not be subject to all these HIPAA rules and guidelines. The privacy rules, the medical privacy rules that would apply to you would be under the Americans with Disabilities Act, and those basically they're not that strict. They basically limit when you can ask an employee about their health information and about disabilities, and they also require you to keep any sort of medical information in separate files outside of the employee file. So if Within your employee files, you also have medical information. You should really separate those. That's a statutory requirement under the Americans with Disabilities Act to make sure that you separate out all of your medical information. You should have a medical file for each employee and a regular personnel file for each employee, unless you just don't have any medical information. But most employers have some medical information just in the course of, doing employment. You're going to get doctor's notes or workers' comp claims or something. So just make sure you store those things separately. And that's a requirement, again, under the Americans with Disabilities Act. But don't worry so much about any sort of like HIPAA privacy laws, because those basically don't apply to most employers. All right, and that got us through the 90s, and now we are going to move on to the now. And I'm going to spend the next 20 minutes till the end of the presentation just talking about the Affordable Care Act. So basically, we had all these little pieces of healthcare reform along the way, right? We had HIPAA, we had COBRA, we had ERISA, all the things I've just talked about. But we've never had anything like what we got back in 2011. And what we got back then was Obamacare, some people call it. I call it healthcare reform. It's also called the Patient Protection and Affordable Care Act, and then people shorten that to Affordable Care Act or ACA. We're all talking about the same thing, and it's really just a group of provisions that some apply to employers, some apply to health insurance carriers, some apply to just Americans in general. So it's just a group of provisions that we got. So what I've done here is I've pulled out the provisions that most apply to employers, and I'm going to go over those provisions with you now. So I'm going to go through those, and we're just going to walk through the ACA together. The first provision I like to talk about, because it really does apply to employers, is lactation breaks. This applies to all employers. It doesn't matter if you have a group health plan or not, if you're big, if you're small. It just says that you have to offer reasonable break times to employees if they have a need to express breast milk in the workplace. We really recommend putting this in your employee handbook. The Department of Labor has issued a statement saying it's not required to put in your handbook, but they consider it a best practice. And when they consider it a best practice, we consider it a best practice. So we have, I think we have 2 or 3 separate lactation sample policies in the HR Support Center. You're welcome to just steal one and add it to your handbook. Basically, your to-dos here are just to make sure that if an employee asks for this, you allow it. These, again, are unpaid breaks, okay, so you don't have to pay for them. But kind of a big part of this is that you have to offer a private location for this, and it cannot be a restroom, okay? So it can be like a private office, a server room. It can be a room you use for lots of different things, as long as an employee would have a private place with a chair. They could lock the door, so they would, have a private place to express breast milk that is not a restroom, okay? So if you haven't added that to your handbook, you probably want to go ahead and do that. The next thing I want to talk about are a couple of new notices that are required under the Affordable Care Act. The first one is a summary of benefits and coverage. This only applies to you if you sponsor a group health plan. But if you do offer a group health plan, for every group health plan you have, you're required to give each employee who's eligible for your coverage a summary of benefits and coverage. So if you offer 6 health plans, every year at open enrollment, you give out 6 summary of benefits and coverage forms, okay? These are made by your health insurance carrier, like Aetna, Blue Cross, Humana, whoever you use for health insurance. They have to make those forms for you, but the employer is responsible for distributing them. So each year at open enrollment, make sure you verify with your broker, hey, you're distributing our summary of benefits and coverage forms, right? Okay? And make sure that these get out. I actually like this form. The federal government likens these to like food nutritional labels, where I can look at a box of Frosted Flakes and a box of Cheerios, and I can tell which one has more calories and more sugar, by putting this side to side. And this form is intended to do the same thing. So what it does is you can take the SBC for 2 different health plans and put them side by side and tell which one has a higher deductible, out-of-pocket maximum. So it helps you compare and contrast plans and your employees to do that when they're picking their health plan. Okay, so make sure those get handed out every year at open enrollment, and then also during the year as new employees become eligible for the plan. Those need to be included in like their new benefits enrollment kits. Okay, if you don't know if you have them or where they are, remember your carrier has to make them, so you can request them from your carrier or your broker. The second new notice applies to every employer in the United States. It's a notice of exchanges and subsidies. I like to just consider this a new piece of required new hire paperwork. So every time you hire a new employee, they do a W-4 and they do an I-9, where they need to receive a notice of exchanges and subsidies now. It's required you give this to every new employee within 14 days of hire, regardless of whether they're eligible for health insurance or not. There's a few things that you fill out on it, and then you give it to the employee. Okay, there's no need for them to sign it and give it back to you. It's just something that it's just a distribution requirement alone. Okay, there's two templates. There's one for a company that offers a group health plan and one for a company that doesn't offer any health insurance. One company would never use both templates. So make sure you download the template that would apply to you. They're both in the HR Support Center, and make sure that you're including that as part of your new hire paperwork process. Okay? The next provision I want to talk about is the 90-day waiting period. So this is actually a maximum waiting period. This applies to you if you offer a group health plan. Your waiting period for the plan for new employees cannot exceed 90 calendar days. Okay? It doesn't matter if you're a small employer or a large employer, your waiting period cannot exceed 90 calendar days. So the most common waiting period we see now is the first of the month following 60 days. That's still compliant. You can't do the first of the month following 90 days because that would exceed 90 calendar days. You can do 90 calendar days, but then you're dealing with like mid-month enrollments, which aren't that practical, and our accounting departments don't love those. So just make sure your waiting period does not exceed 90 calendar days, and you're in good shape with this one. The next one I want to talk to you about is small business tax credits. Okay, so basically, if you're on the line with us today and you have less than the equivalent of 25 full-time employees, and if you averaged all your employees' salaries together, they made less than $50,000, the federal government says, hey, we may offer you a tax credit to help you pay for health insurance for your employees. Okay? And it can actually be up to a 50% tax credit on employer-provided coverage. So it is substantial, and I talked to a lot of the small employers that this helps tremendously in terms of offering health insurance. So make sure that if you think you may be eligible, that you talk to your CPA or accountant about small business tax credits. I do like to point out a couple of things about this. First of all, you do have to shop in your state's shop exchange to be eligible. So if you're interested in taking advantage of this tax credit, you need to make sure that your broker knows that so they can shop in the shop exchange, okay? So that's really important. And you do have to pay at least half of employee-only coverage for this as well. So this is a big deal. My goal today is just to make you aware of this and, see if you may meet some of the eligibility criteria, and if so, to definitely talk to your accounting or tax professional about it, okay? The next thing I want to talk to you about are these state health care exchanges. So no matter where you are on the line with me today, as long as you're in the U.S., your state has set up a health insurance exchange. And when you think of your exchange, I like you to think of it as having two components, okay? First of all, there's a place, let me tell you what an exchange is, first of all. It is just an online place that brings together people who are selling, companies that are selling health insurance, and people who want health insurance. That's all it is. It's just an online marketplace that's supposed to bring together buyers and sellers of health insurance. So think of it as having two components. One is the marketplace, okay? And the marketplace is where an individual, like myself, Jenny Arthur, completely outside the scope of my employment, if I wanted to go buy health insurance, then I would go shop in the marketplace for myself and my family, okay? But the second component is the shop exchange, and that's where small businesses can shop for health insurance. Right now, you have to have less than 50 employees in most states to shop in the exchanges. Some states allow groups of up to 100 to shop in the exchanges. So definitely, if you haven't gone to your state's health exchange website, you may want to just check it out and even just, kind of get a feel for it and see what it looks like. And remember, you have to shop in the shop to receive that tax credit that we were talking about. All right, so I'm just going to give you a little bit more information about the exchanges. My next slide is about the marketplace, okay? So again, employers don't deal with the marketplace too much because this is where an individual goes to shop for health insurance coverage. But basically, the marketplace is you have to enroll during certain enrollment periods and have the next enrollment period appear on your screen for you. But the questions I get asked from employers is like, do I, if an employee goes to shop in the marketplace, do I still contribute to their health insurance? And the answer is no. So if they decline your group health plan and opt to shop in the marketplace, then they are forfeiting any sort of employer contribution to the plan. They may get like some sort of federal premium assistance, but they're not going to get an employer contribution. And there's absolutely no payroll deduction available from marketplace plans. So if an employee says, hey, I want that pre-tax Section 125 advantage we were talking about earlier on my marketplace plan, the IRS doesn't allow you to do that. So the answer is no. Okay? And now I have a couple of slides on these shops, okay, because these are the ones that do apply to employers. Again, they're for groups with less than 50 or in some states less than 100. You can shop in your shop either with a broker or without a broker. The cost is always the same to the employer because brokerage fees are paid by the insurance carrier. And like I've mentioned a few times, you can only get your small business credit if you shop in the shop. So you can shop, there's not a specific enrollment period for small employers, so you can shop in the shop at any time throughout the year. And my next slide gives you just a little bit more information about these shop exchanges. Generally, if you can get your enrollment forms in by the 15th of the month, coverage can begin as soon as the 1st of the following month. And there are some criteria for shop plans. You have to offer your plan to all full-time employees working at least 30 or more hours per week. And there's also this minimum participation requirement where you have to offer the plan to at least 70% of full-time employees. That's in most states. It can vary a little bit by state. If you have a hard time meeting participation requirements, but I know a lot of small employers do, the shop may be a really good option for you, and that's because this last provision, this last bullet here, does not apply if you shop in the shop from November 15th through December 15th of any year. So if you have a hard time meeting participation requirements, talk to your broker about shopping in the shop for between November 15th and December 15th of any year, and they have to offer you coverage regardless of participation if you do that. Okay? And let's see. The last provision I want to talk about before I get to the employer mandate, which is kind of a big one, and we'll wrap it up with that, is employer reimbursements for individual health plans. So basically, you just can't do this. You're probably like, what is this? This is saying, okay, I own a small company. I own Bob's Bait Shop. I have 5 employees. I don't want to deal with health insurance. But I'm going to give my employees, if they buy health insurance, I'll give them like $200 towards it or something like that, okay? And the IRS is saying no more. You cannot do that. Unless you sponsor a group health plan, you cannot offer stipends or reimbursements for individual health plans, okay? And there's actually a penalty associated with this for up to $100 per employee per day. But the IRS has pretty much conceded that if you want to offer money to employees for them to go buy their own health insurance, you can, but that money has to be taxed as wages, okay? And that money, you can't require that they use it for health insurance, and you can't require that they submit, their health insurance bill to you every month. They can use that money for whatever they want. So as long as those things are in place, you could add an extra $200 to everyone's check, but it's going to just be really a salary increase, okay? We get a lot of questions on that one. And now I'm going to talk about the employer mandate, and I will probably spend the next, probably about the next 7 or 8 minutes on that, so hopefully I can leave about 5 minutes for questions and answers. Basically, the employer mandate now applies to any company with 50 or more full-time equivalent employees. This is, I should tell you what the employer mandate is first, probably, huh? This is the provision of healthcare reform that says, hey, large employers, you have to offer affordable coverage or face a penalty, okay? So it's probably the most feared and dreaded provision of healthcare reform. So determine if you have 50 or more employees, this is the formula that you use. And this is pretty straightforward, but what employers do not understand is when you do this calculation, and that's actually very important. So you will be subject to the employer mandate in 2016 if you average 50 or more full-time equivalent employees in 2015. So the look-back period is always the previous calendar year, and you have to do this calculation every month of 2015. So you'll do this for January of 2015, February 2015, March of 2015, and at the end you'll have 12 data points. You average those together, and if that number is 49, you're not subject to the employer mandate in 2016. But if that number is 50 or 51, you are subject to the employer mandate in 2016, okay? So there's no need for you to do this formula if you already know if you're subject to the employer mandate or not. But if you're borderline, this is the formula that you'll use. There are a lot of penalties associated with not offering, health insurance coverage. This next slide kind of details the penalties for you. Basically, there's two penalties. The A penalties is like, look, I'm not offering health insurance. Just find me if you want to, right? And that one is $21.60 annually for each full-time employee, and you can exclude the first 30 employees from that calculation. Okay. The B penalty is like, hey, look, I tried. It's like I offered coverage. Maybe it wasn't affordable, but, I did offer coverage. And that one, you only receive a penalty for each subsidized employee. So if an employee receives a federal premium subsidy, and that amount for 2016 is $32.40 a year. Okay, those penalties are calculated monthly, and they're paid annually. You would never have both the A and B penalty. You would either have the A penalty or you'd have the lesser of the A and B penalty. And the penalty only applies if one of your low-income employees shops in the marketplace and receives federal assistance. So that's the trigger for a penalty. If that doesn't happen, then you can have 10,000 employees and offer no health insurance and not be fined. But as soon as one employee goes and shops in the marketplace and receives a federal premium subsidy, the penalties apply. Okay, so you're probably wondering how I can't control who shops in the marketplace, right, or receives federal premium assistance. And you're totally right. So the next three slides are intended to show you what you can control. Okay, and if you do these three things, minimum essential coverage, at an affordable rate, to all full-time employees, you'll be completely immunized. You'll have no employer mandate penalties. So in my opinion, if you have 50 or more employees, this is the most important part of this presentation for you, okay? And I have a slide on each of these: minimum essential coverage, affordable rate to all full-time employees, okay? So these are like your steps to make sure you're not fined. Step one is you have to offer minimum essential coverage. This has no relation to how much you pay for the plan. Rather, it's how your plan is designed. You have to have a plan that's at least a bronze level or higher plan. All right, so this is a job for your broker. You need to ask your broker, hey, do I offer at least one plan that meets this minimum essential coverage requirement? And hopefully they will say yes. You don't have, not all your plans have to meet this, but you have to offer at least one that is an ACA compliant plan, okay? Step two, that one's pretty easy. Step two is that you have to offer that plan at an affordable rate. This is complex, okay? And this is where employers just like glaze over and like, how in the heck do I know if it's affordable? Just ignore the stuff on the left side of the screen and look at the green, okay? This is how you know it's affordable. You have to use an affordability safe harbor. And there are 3 affordability safe harbors, okay? All of these are based on not how much the employee pays for the plan, but how much the employee would have paid had they enrolled in your employee-only coverage for your lowest cost plan. That meets that minimum value requirement. Had they enrolled in employee-only coverage for the lowest cost plan, that's an ACA compliant plan, how much would they have paid? And you do all your calculations based on that, okay? So the first one is the W-2 wages safe harbor. So as long as an employee doesn't have to pay more than 9.66% of their Box 1 W wages for the employee-only portion of your lowest cost plan, you met that one. The rate of pay safe harbor is similar, except instead of using the W-2 wages, you just take their hourly rate times 130 hours a month, and for salaried employees, you just use the regular salary. And as long as they don't have to pay more than 9.66% of that for the employee-only coverage of the lowest cost plan, then they've met that one. Third one sounds the hardest, but it's actually the easiest because it's a published number. So just forget what's on the screen. As long as an employee doesn't have to pay more than $94.75 a month, I'll say it again, $94.75 a month for the employee-only portion of your lowest cost plan, then you've already automatically met safe harbor number 3. Okay? So you got to meet one. You don't have to meet all these affordability safe harbors. You just got to pick one and meet that one. And the third step is you have to offer it to all full-time employees. Okay? So you have to offer the plan to all full-time employees. Those are any employees regularly working 30 or more hours per week. And we talked about the maximum 90-day waiting period. So the waiting period can't exceed that. You also have to offer the plan to their dependent children, okay? You don't have to offer any contribution to dependent children, but you have to allow dependent children to enroll. It can be at 100% of the employee's cost, though. You don't have to offer the plan to spouses for the plan to be ACA compliant, okay? And there's no requirement that you offer the plan to part-time employees, those regularly working less than 30 hours a week, okay? So those are your 3 steps to completely immunize your company from any sort of employer mandate penalties. Okay? I'm going to spend 2 minutes. I know I'm running out of time, but I'm going to spend 2 minutes on employer mandate reporting requirements. So basically, we're just talking about the 1094Cs and 1095Cs. This only applies to companies that have 50 or more full-time equivalent employees, and these have to be filed on an annual basis. We're actually in the season right now where we're doing these filings. If you're having a hard time, if you're doing these filings and you're having a hard time coding your forms, let us know. We have a great code guide, and I'm always happy to walk through codes with you because I know the coding on these is a little bit confusing. All right, my next slide here shows you actually what you have to do, right? You have to do one 1094C, and then you have to do a 1095C and give that to every employee. You only have to do the top half of the 1095C if your plan is fully funded, okay? And if your plan is self-insured, you have to do parts 1 through 3 of that 1095C form. And my next 2 slides show you who does what. These are some really nice charts. All you have to do is figure out where you are, okay? If you're a small employer, meaning you have less than 50 employees, find where you are, which row you're in here. You either offer a fully funded plan, you offer a self-insured plan, or you offer no health plan, right? So you're one of those 3 categories. The only reporting requirements you have is if you're a small group, is if you're self-insured, okay? If you're self-insured, then you've got to do a 1094B and 1095Bs. But if you're a small group and you're fully funded or you offer no health plan, your insurance carrier has to do everything for you or there's just no requirements, okay? My next one shows kind of the same thing for large groups, so figure out where you are, if you're a fully funded or if you're self-insured or if you're no health plan. So you're just one of these 3 rows will apply to you, okay? If most people who are a large group fully funded, and actually it's important to note that your employees are going to be receiving a 1095B from your insurance carrier and a 1095C from you. You're going to do parts 1 through 2, leave that part 3 blank, and then the part 3 information will be included on the 1095B that they get from their insurance carrier. Okay, so those are some good charts for you. My next few slides, and I know I walked through a ton of provisions of the Affordable Care Act, so my next few slides are simply intended to kind of group those by which ones may apply to you, okay? So the first one here is a cheat sheet number 1. If you're a small company, you have less than 50 employees, and you do not have health insurance, you guys don't sponsor a group health plan, then the 3 provisions of the Affordable Care Act today that I talked about that apply to you are the Notice of Exchanges and Subsidies, so go back and look at that slide, lactation breaks, take a look at that one, and then we talked about no reimbursements allowed for individual or marketplace health plans. So I've already talked about all those things, just go back and reference them. Those are the ones that will apply to you. Cheat sheet number 2 are provisions for small employers that do have a health insurance plan. Again, I've already talked about these 6 things, so just go back and take a close look at them. And cheat sheet number 3 are provisions for a large employer that does have a group health plan. And these are the provisions today that these are the provisions that I talked about today that would apply to you. Okay, cheat sheet number 3. And that concludes my presentation. I know I didn't leave a whole lot of time for questions and answers, but what I'm going to do is I'm going to go ahead and turn it back over to Sarah, and she's been monitoring your questions through the chat feature as I've been talking. So she'll go ahead and field those over to me. So I'm going to turn it back over to you, Sarah.
Yeah, thank you so much for that, Jenny. That was really great. Yeah, you all have asked some really great questions. I know we're just about at the hour, and so we'll probably spill over a few minutes, so apologies for that. But yeah, I'm just going to go ahead and jump into a couple questions here. So the first one says, can I use a simple 125 plan for my POP or my POP, not have to do testing if my group is under 100 employees?
Gotcha. Yeah, you can use as long as you're not offering, I'm assuming you're not offering any sort of flexible spending accounts or anything like that. And if you have like a simple 125 plan, then you generally, there's a couple tiny little tests that you have to do. So definitely get with your broker and make sure almost every plan like that applies with the testing, no problem, okay? But there are a few little requirements, so make sure you get with your broker and make sure you know what those requirements are.
Perfect. One real quick one says, what does CHIP or CHIP stand for?
Oh yeah, that is CHIP is like it's like a state program. Not every state has it. It's for children to get health insurance. So what it does is it's like this plan that's state funded, and it's a very low cost way for generally children. In some states it applies to older other people as well, to get low cost health insurance. So sometimes an employee will be on a CHIP plan, I think it was under qualifying events, and maybe lose coverage under that CHIP plan or discontinue that CHIP plan, and that would be a qualifying event. Okay?
Perfect. We've got another one here. If an employee elects COBRA within 60 days, do they pay the premium back to their initial loss of coverage date?
They do. So with COBRA, there's never a lapse of coverage. It has to be completely retroactive to the day they lost coverage. And yes, you will require, if they wait that full 60 days, it's actually usually longer than 60 days because it took you a while to even get the notice to them, right? You have 44 days, they have 60 days. You can see you could be out a bit, but yes, they are required to pay premium, all those back premiums.
Perfect. We've got another question here. What if the person isn't on our insurance because they opted out? Would you still have to offer COBRA?
Okay, if they opt out like at open enrollment, it's like, I guess that's what they're saying. If they decline to participate in the plan, then generally no, COBRA doesn't generally apply to that. Or I don't know if you're saying open enrollment. It may be that they're saying if an employee just opts out of the plan. If they're never on the plan at all, then COBRA never applies.
Perfect. We've got time for just one or two more real quick. This one, I'm curious if you know, with regard to giving money to employees for premiums, isn't there a ruling for 2017 that will allow certain employers to pay for Medicare premiums for employees?
I'm not totally sure on that. There are some different rules. So one of the rules is if you only do it for one employee, it's okay. Okay? So if it's not a group health plan, if you only do it for one employee, offer a reimbursement for one employee, there's an exclusion for a one employee deal. Okay? And there are a couple of exclusions for some Medicare, different parts of Medicare, and I don't know all of those. So I'll probably have to research that one and get back to you. And I'm not familiar with the 2017 ruling that you're speaking of.
Perfect. And then just one final question we've got time for. When employees go on COBRA, can they elect a different plan offer than what they had?
Generally, they have to do the plan that they had already, what they were already enrolled in at the time of separation.
Perfect. All right. Well, thanks again for all of your great insight, Jenny. And thanks, everyone, for your time today. If you do have the HR On Demand service activated and would like to speak with Jenny or any of our other pros on this topic, please give us a call anytime. I know this can be complicated stuff. At this time, I will just go ahead and turn it back over to you, Kristen.
All right, thank you so much to Jenny and Sarah for your time today, and thank you everyone for joining. So before you jump off, I just want to let you know that all of our HR clients do have access to HR Support Center. So we provide you with a plethora of resources to help you to stay informed on everything pertaining to human resources. Something else to keep in mind, a lot of questions came up about benefit enrollment and about COBRA administration. Those services are both things that BeyondPay offers with our HR tools. So that might be something that you want to consider if you're looking for a provider to help you with those processes or to understand that a little bit better. We are here to help. So we don't only do that, we also do full HRIS, benefit open enrollment, payroll, and time and labor management. Also, we have an ACA compliance component that is really incredible that a lot of our groups are using to help fill those 1084 and 1085C forms. So thank you again for your time today. Thank you to Sarah and Jenny, our partners over at HR Support Center, for such an incredible insight. We are excited to follow up with you all with today's slide deck. And any questions that you may have, don't hesitate to reach out. Again, my name is Kristen Justice with BeyondPay, and we are so excited to be able to work with you to help you and to provide you future insights with HR Support Center. So make it a great Wednesday afternoon.